Oh, there you go. Yeah.
Yeah, you're finding it.
Oh,
Oh, man. Oh, good grief. Wow. I feel like way more loosened up than I have in years.
So just neck pain, both sides, and has that changed over the years?
it seems like a lot of it is scalene muscles.
Okay.
I mean, you can feel nodules, and I don't know if they're trigger points or what they are, but they're tender to the touch. I
Okay.
self-treat those a little bit.
Okay. When you have a car accident, I mean, before we go deeper in this, when you have a car accident, your body expects it to happen again. So whenever you have an injury, your body puts up walls, fortifications, in guard mode, because it thinks you're gonna
Right.
go through that again. And so part of care it's necessary after an accident is to not let you go into avoidance. First of all, that's the first thing. Your body will change your posture to move the pressure off what's injured, and then it will lock down what's injured. That's part of what you're seeing. My scalenes are telling the time, well, that must have been what the scalenes are, just part of what your body's using to protect a deeper structure that has had injuries, or now there's arthritis or crystals in there. When's the last time you had any pictures taken of your neck?
Oh, geez, it's been
Long time.
at least 10 years ago.
Okay. All right. Well, typically what we see, and just kind of backing up a little bit, when there are 24 segments in our spinal column, 5 have all surgery, and there's really no TV commercial that highlights this or lets us know that we have a disproportionate amount of aging or arthritis in the last 2 segments in the lower back and the last 3 segments in the lower neck, to the point where that's almost exclusively where everybody has surgery.
Right.
When we have a whiplash, typically the alignment that you're in before the whiplash, and which is predicated by all the years of school, guitar since 8 years old. So we're doing a lot of this, not a lot of this, not having Dr. Bo, my father is your father, and previous injuries to that car accident set you up wherein the lower neck takes most of the punch. And when the lower neck gets injured, the head typically goes forward, the muscles get tight, because when the curve is in your neck can be relaxed. When your neck goes straight or reversed, the muscles are perpetually tight because of posture. So there's a combination of the two. Injury and then alignment are the two things that are creating that constant tension.
See, a little harder to turn.
Go ahead and turn left again. Now, when you turn your head left, you want to bring that right shoulder forward. So part of what I call it the Larry King. No, you don't want to see. Watch me. Look at me for a second. Look at me for a second. You're part of what. So you should be able to turn your head. You see how I'm not using my shoulders? Yeah. When you turn your head left, now you didn't to the right. When you turn your head left, you did this. You're saying you cheated. I call it the Larry King model. Right. Larry King was my poster child for. It was like he turned with his torso, not with his neck, because his neck was still stiff. But go look up for me. Just try to gently look up. Okay. Yeah, we're gonna work on that extension, and then look down for me. Yeah, your neck is really used to going down, and then looking up, we got to get used to a little bit more. Yep. Look straight forward. Yeah, you're good. We're doing about an inch and a half forward from your ear to the center of your shoulder. So the head weighs about 10 pounds. Every inch it goes forward, the muscles have to double their workload. So 10, 20, 40, somewhere between 20 and 40 pounds is how much muscular work your neck muscles are having to handle. Hips are pretty level, not having to, I'd say pretty level down there. We just have head translation. We have it on your back for me. Goal of the adjustment is to take the parts that are frozen and loosen them, and then leave the parts that are older alone.
Okay.
And that's the Jenga skill of the adjustment, is can you, Dr. Ed, loosen my upper neck, which is primarily what I just told you has no surgery, without manipulating and touching my lower neck, and my middle back without touching the lower back.
Okay.
Bend the knees for me. There we go. Cross this arm under. All right, take a deep breath in, a little sit up for me, and then lay your head back for me. Here we go. Oh, I know. Deep breath in.
No, it's good.
Here we go. Exhale. There we go. Deep breath in. Very good. One more. Exhale. Nice. A little surprising. You okay?
No, it's okay.
I'm good.
I have a high tolerance for this stuff.
Yeah, there we go.
The sacro joint.
Yeah, we're going to loosen up. So we're going to loosen up this sacroiliac joint, and then we're going to loosen up the middle back here a little bit. Deep breath in. Good. Breathe in deep. Exhale. There we go. Here we go. Oh, good. That side for me. Good. Very nice. Take a deep breath in. Exhale. face up for me. Very nice. Just let me feel here. Yeah, I mean, maybe you've noticed, feel how large this is on the right.
Yeah.
I don't really have much.
And there's some things, I don't know what these are, but there's like little nodules right through
Lymph nodes.
here.
Yeah. The lymph, there's definitely a tighter, see the bone is drifted over to the right, and so the muscles here are working harder
Right.
because the bone's not leveled up here.
Okay.
Now, part of why that happens is because of either, like I said, whiplash injury or the alignment that starts to become misaligned at a young age. Everything's over to the right here.
Plus my day job is at a desk, hunched over all day. I try to sit up straight, but you know how that is.
I get you. I get it. It's a battle. Yeah. So all the bones are shifted over to the right, and because they're over out of position, the muscles are having to contract to hold. It's like if I hold a bowling ball farther away from me, right? I have to work harder because it's not the right alignment. If I hold it closer to me, it's less work.
Yeah.
The farther out of position or subluxated that a vertebrae is, the more the muscles are working to hold it all together. Part of that can be joint injury, disc injury. There's something that's unresolved inside that needs to be shine a flashlight on to clean up and fix, and then the body won't need to avoid it. Like there's glass on the ground, you keep on taking a detour around it. So how about we sweep up that glass, and then you won't need to take this detour, right? But there's something in here that your body's detouring around, inflammation, crystals, arthritis. But yeah, this right side needs some attention, so we're gonna start on the right here. We're pretty gentle here, just gonna try and move this top guy a little gentle here. There you go, here we go.
Oh.
There you go. Yeah. Okay, a little surprising, yeah, I know.
It's loud.
You did great, you did great. Pretty boring, you just gotta sit here and work this, like I said, like scrubbing a tub.
Well, do your thing.
Okay, we're gonna scrub all this. If I'm going too hard, let me know, I'm gonna keep going deeper.
I have high tolerance for deep tissue
All right.
massage.
All right.
I have had a few deep tissue massages over the last few years.
Okay, has anybody seen this? I mean, they kind of tackled this a little bit here.
Somewhat,
Try and-
although therapist skill levels vary.
Okay.
Yours is better. So
I wake up every morning for the last 15 years, and this is all I do. So there should be an effortlessness. I don't know what an analogy would be. There shouldn't be I don't know if you have your strings in the guitar so taut. They should be able to move, but not so loose. There's a balance somewhere in
they
there.
shouldn't be flopping on the neck, but they should be
Right.
mobile.
Right.
Yeah.
Right. These strings are held wound up too tight.
Yeah.
So we gotta loosen these cables a little bit.
Yeah. That's good. Ooh, that's the.
Mm-hmm.
This is where the toxins come out.
That's right. Yeah, the Chinese figured this out a long time ago. You can just comb the tissue and the acidity, like right there, right over that.
Probably light up like a Christmas tree
Yep.
would be my guess.
So the tighter the muscles are intricately woven with the lymphatics, and when the muscles get tight, they crimp the lymphatic lines that drain the nodes, and that's what you're noticing in your neck are
Yeah.
blockages where the lymph is our sewer pipes, and so essentially it ultimately drains to your bloodstream, but it's a way to process dead tissue, and your body channels it through the sewer pipes.
Yep.
Okay, and so it's like a comb to your hair to me, to some degree. Like, you can't use your fingers through your hair the same way a comb.
Right.
Right? So there's different tools for, this is like a comb for the muscle fibers. It combs them and tries to align them so that most of the fibers in the neck, for instance, run straight up and down, right? So you're gonna see me, I'm not combing so much this direction, right? You're combing along
in the direction
the fibers run, right? So
Makes sense.
yeah. And when we have an injury, the original tissue is pretty lined up like this, right? So it contracts and stretches and contracts. When you have a tear, it heals
Right.
like that. And so you go to stretch that, it's like now it's doing this.
Yeah.
It's not doing the original. And so what we're trying to do is we're combing the tissue, right? We're combing that, trying to get it somewhat back to close to the way it was
Right.
when you were born. That's it.
Makes sense.
It's just we have injuries and whiplashes, and we don't heal the same. The fabric has a patch now in it. But yeah, it's bigger right there. There's a much larger, darker mark, right?
Yeah, I can feel it.
Yeah, but on his, you see that, babe? On his right side. I mean, there's some on the left, but this is at least 3-4 times.
Wow.
We want your neck to bend where it's young. And that's why I asked about a picture earlier, and that would be the proof that I could show you and say, here, look, your upper neck is the same as it was when you were 20, and your lower neck is now 80.
Right.
Right? So part of your spine is older than you are, and part of your spine is, most of your spine is younger than you are. And so the postural work, the goal is for it to happen not where your spine is older, it's for it to happen where it's younger,
Right.
and therefore it isn't difficult. But it's stayed young because it doesn't move. And so when we ask you to change your posture, your body's first, inclination is going to be to do it where you're loose,
Yeah.
and therefore, ow, you're hurting me. Like right here, these are lymph nodes. Yeah.
Yeah.
Mm-hmm. They're feel like little peas.
Yeah, exactly.
Mm-hmm. It's outside of the circulatory system, so it's not like you're sick. Does
Yeah.
that make sense? It's outside. It's not in the.
And my first thought was, are they trigger points or what are they? But I'm glad
Mhm.
you clarified exactly what we're dealing
Yeah,
with.
yeah. There's around the sternocleidomastoid. This is the barrier we use. We call them anterior cervical chain, posterior cervical chain. There's all these lymphatic network chains around
Right.
these muscles, and it's what drains your sinuses, your face, your ear, middle ear, all that drain. Left high shoulder, which is elevating his whole left side, and that's making his head go over to the right. Must be how he plays. In a way, like you said, you're sort of tilting and leaning to the right.
Yep.
Yeah, and so the position that you're in for the most amount of time is where your body wants to
go.
stay forever,
Yep.
right? And so then it's like chewing. It's like if you only chewed food on the right side of your mouth. The teeth on the right would age at a faster rate.
Your jaw would be
Right.
larger on the right side.
Be all Popeye on one side.
Yeah.
So it's balanced. The muscles are working hard, right? So all that, when I look at your pain diagram, all this tension all over his back, ultimately, the work that you're doing, the playing that you're doing, puts your spine in alignment that could be a result of the injuries that accelerate. You have an injury in your body, goes to a position, then you're more comfortable in it, you sleep in that position, and now to undo it, we have to spend
I'm a
time.
side sleeper generally.
You sleep on the left side? What do you?
Both,
Uh-huh.
either, but I generally don't sleep on my back, or I do occasionally, but I definitely don't sleep on my stomach. My
Yeah.
arms go numb if I do that.
Gotcha. Yeah, we just need to remind this part of your body that's try to move some work back over here.
Oof,
Mm-hmm.
it's sore. Feel that, it feels like
Yes,
scar
sir.
tissue in there.
Yep. Yeah.
That's what I was talking about.
The crunchiness on the
earlier.
left side
It makes
here?
it- You literally can hear it when you're moving it.
Yeah.
I can hear it. You can hear it externally too.
Yeah. There's just cables. These are all these cables around his shoulder blade that are.
Yeah, that's where oh man.
Yep. The ribs are elevated too, also. So it's not only that the cables are tight, but the ribs are elevated based on that tilting that's going on, and then that makes it easier to strum the strings.
Yep. It hurts, but in a good way.
There we go.
Oh man. Jeez.
I didn't know it was all in there, Ed. Yeah, until you started digging.
Good Lord.
Right there, yep.
I occasionally have a mid-back pull, and that's
Mhm.
rare, but it happens where it just, I don't even know what I did, and all of a sudden I feel like
Well, there's an injury. There's an injury there.
walking along, if you're a twinge of pain, and it lasts for like 2 days. Ah, jeez.
Mm-hmm.
So. Yeah, you're finding it.
That's what the twinge is. The twinge is there's
Yep,
something in
that's
there. And then all,
exactly there. It's right there.
right. All of a sudden you compress this and then you step on the glass.
Yeah,
that's the best
exactly.
analogy. You're walking over an area and then you step on that piece of glass that's in here.
That describes it
And
perfectly.
you're like, whoa, what the heck is that?
And it can be just walking. Like,
Right.
Why did that happen now?
Well, you became more upright for a second. Maybe you had to lean up to grab something, and then it compresses this area. While if you can stay forwardly rotated, you don't notice it as much, and then something happens where you have to come back onto the joint.
Right.
The joints are loaded with pain fibers, and that's the back side of your spine.
Mm-hmm.
And hence why every elderly person's all
Hunched
quasi-motoed.
Yeah.
They're running away. And you can, but then your shoulders fall apart, your knees fall
Right.
apart, your hips fall apart, your organs. I asked about your stomach was, the nerves that go to your stomach come from in here.
Yeah.
And so quite commonly when there's a lot of inflammation in here, indigestion, problems of the rest of the digestive system happen because the nerves from your back are inflamed and they shut down the organs.
Got it.
So the world doesn't connect the dots that, oh, by the way, your stomach issues are really a spinal issue.
Yeah.
How many other people in your band?
I'm actually in two different groups.
Uh-huh.
One does original, one does cover and original. There's 5 people per.
Okay. Can you sing and play?
I do some vocal, but I'm not the one that would do lead vocals.
Got
Probably 10% of the material I'm doing some type of harmony part or background vocal.
Okay, I got you. Little Dave Grohl, I got you.
Yeah, it's pretty much playing guitar.
Okay, I got you.
There, you can hear it.
Yep. Just keep it aside. Eventually, it frays the rotator cuff tendon. If you leave this here for decades, you'll actually have, they're telling me I have a torn rotator cuff. So that was based on the alignment that your shoulder was in for a long period of time.
Right.
Made the tendon easily tearable.
Yeah, that's what I want to avoid.
Mm-hmm. Mm-hmm. This all has to go in order to bring your shoulders back. This all has to clear out.
Oh, jeez. Oh, God.
Mm-hmm.
If you need a break, let them know.
No, I'm good.
I got Kit Kat bars over there. Give me a break. Break me off the piece.
Whenever I do deep tissue, they're always like, "You doing it too hard?" I'm like, "Nope."
No good, get it.
Nope. Go
All
for
right,
it.
that's the patience I like. Let's get it
out of there.
Yeah. Don't put a limiter on my throttle.
Absolutely
Mhm.
not. No governor, please.
But no governor, that's right.
Oh, man.
That I hear. Yeah.
You can hear that.
Mm-hmm.
Oh, good Lord.
Hello.
Oh, man.
Am I bothering anybody in here?
Yeah. They're upset.
Excuse me.
They haven't been disturbed in a while. Party's over, guys.
Party's over, get out! There we go. Yeah.
Oh.
Yeah, I went to undergrad at Eckerd College, so I made that drive up to St. Pete
Yeah.
quite a bit. Yeah.
Am I turning super red?
Yes, sir.
You are.
I kind of figured that.
Yeah. There's.
Lots of
I've
red.
seen some of the videos, some people turn light red, some people like deep red.
Yep. Yep. So I really appreciate about the gua sha. It gets the whole tissue. I love cupping, but you're missing something sometimes.
I did have that done once. Yep,
And they do stuff where they move the cup, which I think is a little better if you can move the cup around, or then you have to replace it, and it's a little too inactive for me. It's kind of a set it and forget it. I like the gua sha. It gives me
Gotta do the,
get a kinesthetic awareness of the tissue by working it.
I have to agree.
But that's Michael Phelps opened the door for everybody during that one Olympics. He had all those circular hickey marks all over his chest, and the most decorated Olympic athlete of all time. He's got bruises. Pretty sure he's not doing that to goof around,
Yeah.
right? I mean,
I think he knows what he's doing.
I think he knows what he's doing, right? He's got 20-something gold medals. Maybe there's something to this gua sha and cupping. Epsom salt bath would be just almost a requirement when you get home. Just if you can soak in a tub, 15, 20 minutes, couple cups. Minimal water initially if you can, if it's not too uncomfortable, or just get it as concentrated as possible if you can, and then fill it up and then soak. But drink a little bit, throughout the day. Drink some extra water today.
Ooh.
Yeah. Right there.
I can feel that.
Right, exactly. That's the sensation. It's exactly that you feel. It's like that doesn't belong.
Yeah. It's like a stiff knot that's tender to the touch.
And there's that spot.
Full synthetic.
Full synthetic, right? It's all pouring out of here.
Last me 5,000 miles, hopefully. Even the tricep is sore. I don't know why that is.
Well, you're a guitar player. I just.
Well, yeah.
Once you told me that, I have enough of I've worked on enough musicians.
Yeah.
I know where you guys hide it. Where you guys hide everything. All your spinal sins.
Yeah. Oh, man. Oh,
Okay.
particularly there.
I feel it. No, I see it.
Dang.
Right behind the shoulder.
Oh, jeez. I mean, it hurts. It hurts good, if that makes sense. It's the only way I can describe it. Oh, jeez. Ah. Man.
Real quick, it comes out. Just
Instantly turns.
pretty much.
Huh.
Yeah. When it's that tender to touch initially, just on light pressure, that just means there's a lot of acidity.
Yep.
It's like having a bruise on your arm and you touch it and it's real sore, and then the bruise goes away and then it's no longer sore. It's that, but at like 10 times the level,
Right.
right? So there's no normal lactic acid, or soreness build up in your body. It's trapped either from repetitive motion, posture, and there we go.
almighty. Oh, man. Oh, God.
Why? Why is that in me, Ed?
Right?
Who put that in there?
Jeez. Good grief. I can feel that all the way to my fingers. Ah. That side's worse than the other one. Oh, God. Ah. Yeah, that tries this sensitive.
It's all pouring out of it.
Ooh.
Yeah, no, it's a lot in there, brother. This is a guitarist shoulder. This is what hairstylists will have the same thing. Hairstylists, guitar, musicians. It's because when you're in the middle of playing for 4 or 5 hours, you can't like, oh, my arm hurts. Let me just stop playing.
Push through.
You just shut. You tell your shoulder to shut up, and you keep
Keep doing it. Keep playing until the show's over. Till
right till the show's over.
that's it.
And that's what this is.
Yeah.
This is abuse. Your body told you to stop, and you said sorry.
Gotta finish.
You got to finish, and you had your arms in a in a aberrant posture. Let's call it,
Yeah.
not center posture, and so.
Ooh, that's crunchy.
Mm-hmm.
Oh, God. Oh, man.
All right. Sitting creates this. This is your sitting
That's
muscle.
my day gig.
Right.
Oh, jeez. Oh. Oh, God.
Right there. Yeah.
Yeah.
I should show you the pain diagram chart. On that body chart, he was like, "It's everywhere." He had the whole thing. He had the whole thing marked. Some people just make a giant circle. I like how you actually drew. I appreciate that. Some people just go.
I like tried to X out right where it was.
He put detailed marks on where everything was. Like, okay, I'll check it all
I
out.
was like, he's got it everywhere, pretty much.
Bang for my buck. Gonna spend as much time in the areas that he marked.
Right? Oh,
Uh-huh.
good grief.
That side too. It's weird. It used to just be on my right, but now you never know. Sometimes it bothers me from the left. Sometimes it bothers me from the right. But there's something going on right there.
Right there. Yeah,
Jeez.
that's an injury. That's not just sitting in the chair. Something happened now.
Oh God.
The difference, that's an injury. It actually stays in a certain border. That's where the bomb went off and it shrapnel went around. But yeah, that's because it pretty much just stops right there at the crest. It means it goes right to the crest, and then that's where the. All right, yeah, come on up for me.
No, good grief. Wow.
That's it.
Yeah, you can see where the trouble spots are.
There's shoulder there.
Yeah, I didn't just turn red. You're right. I turned like.
That's like
purple,
dark. Yeah, it's
dark
old
purple
stuff.
spots.
And like probably could overlay that with where you were scribbling.
Yeah, no kidding.
Yeah, that's all inflammation that's just trapped in there.
Wow.
Suck that out. It's going to be a little bit worse for a couple days as that's stirred up. But then
Right,
when
I
those
figured.
marks go away, you should be like, there we go.
Yeah, I feel like way more loosened up than I have in years.
Now that we got some of the muscular tightness out, I'm trying to see if I can get the joints moving a little better. There we go. There it is. Nice. Yeah. There's more in there. Let him go. There we go. Couple more moved. Yeah, there we go. All right. Old fortifications that were busted loose. Your body's not going to just welcome that with open arms.
Yeah.
It's going to have to be. I use the deep tissue work to make it less agonizing, but
Yeah. Oh.
the hamstrings, Ed. Oh.
All right. Oof.
All right, 1 second. Let me get contact first, and then. All right, go ahead and tilt right a little bit. There we go, a little bit. Okay. There we go. Tilt right. Okay, it's okay. All right. Tilt your head to the left a little bit for me. There, a little bit.
You're gonna pop.
A little bit. Tilt to the left. Okay, all right. Oh boy, wow. A little sore in here.
Little.
Uh-huh. Too much weight on the toes is going to make these joints get inflamed. Part of it is when your head goes forward, the weight goes onto our toes. The weight
Right.
belongs back here on your calcaneus.
Yeah.
So you got metatarsal, tarsal, phalange inflammation here, but I would take a gander that it's because you got too much stress on these toes. Wow, okay. And you want to work on this direction. You don't want to do that.
Yeah,
You want to curl.
that way.
Yes, sir. This is what causes hammer toes and bunions, all that kind of stuff happens because there's too much weight.
Right.
All right. I got you. There we go. Okay, got you. Kind of targeting the middle, leg straight if you can, if it's not too uncomfortable. And then you'll take your hand, you'll place it on your forehead to get your head to sink in. Does that make sense?
Mhm.
If you can, a little bit, and then put your hand back down. So you just do that for just briefly. Does that make sense?
Yeah.
To get your head to sink in. And then it's really you're just relaxing. It's just time.
Okay.
Middle upper neck is where we're trying to target. So not where it might have inclination to fall down to your lower neck where it's looser, right?
Right.
Into the valley of your lower neck. We want to keep it in your upper neck to make that area do the bending. And that's how we're going to reduce all that tension in your neck. We have to get that curve back in your neck.
And this is to help restore the curve.
It's the only way.
Yeah.
It's stretching that makes the curve go away, and it's stretching that restores it. For 100 years, chiropractors taught that adjustments can do it, and it's not possible.
And how often should you do this?
20 minutes a day
20 minutes
is
a
minimum.
day. Okay.
But the first checkpoint is 20 times 20 minutes. So if you did 2 a day, it'd be 10 days. You want to do it 20 times for 20 minutes.
Okay.
I usually put the TV on or music on. You lay on the floor. I have patients that actually put TVs on their ceiling. Whatever. I'm just saying whatever works for you. But it's just letting your body sink into the ground. See, by the 12th time you do it, you're actually starting to do it properly.
Right.
The first dozen times you do it, you really aren't even doing it properly because your neck is still so stiff, it doesn't want to go into it.
Right.
That's partly my job on the table, is to get you loosened up so that your neck is compliant, so that it'll actually stretch over the device. So sometimes patients will say, it wasn't that difficult initially, and now all of a sudden it's difficult. Does that make sense?
Yeah.
Because now you're actually doing it properly, your neck's actually bending into it. So the contraindication, if anything starts going numb in your hands, anything going tingly, anything burning down the arm, get off. It shouldn't happen, but the goal, generally though, after about a month of not being adjusted, I probably wouldn't do this. It's meant to be used in concert with care.
Okay.
It's so if you at the very least deep tissue massage on the upper neck. Just look left for me. There we go. Wow. Yeah. Turn it right. Yeah. Look up for me. Yeah, much better. Yeah. Just made your joints all supple.
Yeah, it's nowhere near the stiffness I had before.
Yeah. Very cool. All right, well, appreciate it. Sure.
Nice to meet
Talk
you.
more,
Yeah, thank you all very much.
It's
Appreciate it.
great.